Well, everyone wants to look younger, and on this show, we are going to make two of our patients very happy today, right?
Absolutely. We're going to talk about a new filler for both scars and bigger lips.
All right, and everyone always comments on our shows when we do the before and after. Everyone wants bigger lips. Everyone wants to look younger. What does this product provide?
Well, this product provides fullness, okay? It's basically a dermal filler, and we use a very tiny needle. And we can build up lips, we can help with scars, we can help with creases. So, if you have any of those who want to learn more, definitely tune in.
Okay, so we are going to have two people with us today. One is one of our newest reporters who had some scarring from acne when she was younger. And then we have another resident from the area, and she is going to get some blemishes removed from her skin, and also she's going to get the lip injection. So stay with us right here on Skin Sense. And if you're just tuning in, you're watching Skin Sense right here on SSP TV. It's a popular thing that people are getting now, and that's Botox and different forms of fillers in place of plastic surgery, and it's less expensive, less invasive, and we have one of our newest reporters with her. We figured, let's get her on the show. This is Jasmine. Y'all see her around town, and we're going to do a procedure on her.
Absolutely. Just be nice to me. I have this needle here.
Yeah, you never want to be mean to the person with the needle.
Especially Jeannine. I'm very tempted.
Yeah, well,
but
we know.
Anyway, so Jasmine has a little bit of scarring here. It's hardly noticeable, but in certain scars become more noticeable than other scars. And what we do, depending on the scar, some scars are very, very tough to get out. So-called ice pick scars, those real deep ones, they're very, very tough. And you can do laser, you can do even what's called dermabrasion, sanding down. Even then you don't get good results. But with more shallow scars, what we can do is use a filler. I'm using a filler called Prevel, which is made from hyaluronic acid, which is a basic ingredient in all our skin cells. And what we do is we basically just put a little bit under the scar and we lift the scar up. So that's what we'll do. And like I say, Jasmine, she really has minimal scarring. But I mean, it's bothersome. And she's got a little millia by this scar here. But what we'll do is we'll put a little area here in. And what we do is we basically try to lift up that scar as best we can. And over time, and she's got that little white thing here is actually a whitehead. We're going to take that out, okay? That'll be another show, okay? So we can take that out.
A whitehead show?
Yeah, a whitehead show. All right, maybe I could take it out before she leaves because it's easy to do. But you see how simple it is, and we lifted up that area. Now, we have another area, say, over here, and this has xylocaine or numbing medicine inside it. So Jasmine will be asleep within 30 seconds. No, just kidding.
She's not anchoring tonight. We're good.
There. But this is how simple it is. And, unfortunately, the results are not permanent, but you can get really good correction. Let me just get a gauze over here.
How long will this last?
Well, it depends on the filler. Okay, this particular filler lasts several months, about 3 months or so. But the good thing is they've actually done studies to show that the more times that you actually put a needle in these scars, what you're doing is you're breaking up the little fibrous tissue underneath, and you're actually promoting new collagen to form. So that alone, just what we're doing with a little tiny needle is going to be very helpful. And of course the filler gives you immediate correction.
Now, is it silly to ask with the other fillers that we do, the Botox and the fillers on the other portions of the face for wrinkles, does this wear off if she was to be a smoker?
Well, if you're a smoker, yes, any
Okay.
filler is going to go down a lot faster if you're a smoker because there are ingredients in cigarette smoke which have a really bad effect on the skin. And what they do is they absorb collagen and they absorb a lot of the material that we're putting in. So yeah, if you're concerned about wrinkles and you're a smoker, well, I would give up smoking and concentrate on the wrinkles. Okay, very, very, very important.
But Doc, for the marks, does the filler break down the same way, so it won't last as long
if you're a smoker? Yes,
Okay.
that's true. That's true, because a lot of these fillers are basically liquid skin. So you have the same effect that cigarette smoking has on normal skin as you would with this. And that's really it. We did a couple of these little shallow scars. Okay, you can see it's a very simple procedure. And it gives you immediate results.
How you feeling?
Beautiful.
Did it
See,
hurt?
that's great.
It didn't hurt. No.
No, it
didn't.
pinches for a second. Okay, and again, it does have numbing medicine inside it. The older fillers didn't have numbing medicine. This one does. So it's virtually painless.
On top of filling in the scars, now we're also going to use the rest of the filler, like we said, from the nose down to do some of this creases, some of these creases, right?
And again, what we're using is a medication called Prevel Silk. It's very clear. I mean, you can see it has no color to it. And it's made from an ingredient in normal skin, hyaluronic acid. It's in all skin cells. And it's a great filling agent. And what we're going to do, and Jasmine's young, okay, so she's just starting to get these creases, which everybody in the world has. But the way we correct them, and little tiny pinches, is we actually put filler.
Talk about the filler for people at home who
Inside this
aren't
area.
familiar with what's in the filler.
Right, what's in the filler is basically a component of normal skin. Now, there are different fillers, okay? Some fillers have what's called calcium, which is liquid bone. That filler is called Radius. And we've done shows with Radius. It's a little thicker than this filler, okay? It lasts longer. There's another filler called Juvederm, which, again, same ingredient as this, only it's a little thicker. Okay, so it gives you more bulk than this one does. This one is excellent for doing, say, the lips, okay, which we will show. But there, we built up this side, and you can see she's fuller there. And then I'll come around here, and we'll build up this side, and we go right in here. And again, there is a pinch, and it does have xylocaine, which temporarily can sting, and then the stinging's over.
No pain, no gain, right?
Well, that's one way.
A little bit of pain.
Yeah,
It's worth it.
Yeah.
Or people wouldn't get it done.
Now, if she had thinner lips, she'd be a candidate for the lips, but her lips are great. Of course, you know, you excluded, but virtually every TV news anchor, certainly on Fox News, has their lips done, you can see. But to me, some of them are just way too big. Way too big. And we're just going to put a little bit more in here. And then that is basically it. And people can experience a little redness afterwards. That usually goes down within a day. It's very easy to cover up. But basically what we're doing is we're filling in those creases. And, you know, as everybody gets older, they get those creases. It used to be the only way to correct them was surgery, okay? You'd be actually pulling back here, and very, very expensive, and it's an invasive procedure. This is an office procedure. It takes, as you can see, you know, a few minutes. And you are a new person.
Thank you, doctor.
Oh, you're quite welcome. Here, and yeah, Jasmine's all set. And hopefully she'll have a great weekend. And you know, nice thing about fillers, you can be very subtle. Okay, some people tell me, well, I don't want my husband to know. So then we do it gradually. Other people, you know, if you want to be on Beverly Hills Housewives, well, then you want the works. You want your lips, you know, like so big, you know, they'll stick to the wall. But that's the rarity around here. I guess that's the norm in Beverly Hills.
Welcome back to SSP TV. You're watching Skin Sense, and you met Jasmine. She had some of those minor scars filled in with filler and also some minor wrinkling in your 20s, so she didn't have a lot to fill in. Now we have another guest with us today as we talk about fillers and show you how to make some minor improvements to your face for to look good, feel better about yourself, and they're all safe procedures. And we have Marie Kay, so thanks for being on the show.
Thanks for having me, Jeannine.
What are you expecting out of today's visit?
I really don't have any expectations, just whatever Dr. Schleicher wants to do, and he's going to make me look a little bit better.
All right, Marianne is too. And Marianne, thanks for coming on the show. We're educating people about what they can do for their face and without going into surgery. And this is something with the fillers and making sure we have all those whiteheads and blackheads removed from the surface of our skin. So
That's correct.
What are you looking to do today?
Well, what we have here, Marie was concerned, she has a tiny little white papule here, and she has another tiny one forming like right above her eyebrow here. What these things are called are millia. It's a very simple little procedure that we do to extract those. Now you can kind of pick at these and whatnot, and they look like a whitehead. They're not an ordinary whitehead that, not to be gross, but that you can pop, you know, if you squeeze together, that it will pop out. What we need to do, as I said, is very delicately open that, and I have a special tool here called the Comedone extractor. And once I open that little pore, I press the extractor onto that lesion, and that should express it for her, and she's rid of that.
All right. Are these something, so people at home, because I know sometimes if you pick too much, you can leave scarring on your face.
Absolutely.
When is the right time to actually extract yourself, and when is the right time to come and get them extracted by a professional?
If things do not respond to your little bit of things at home that you do, and I'm not saying go crazy until you make a scab or a scar or something on there that can be even permanent on your skin. If you have a little lesion like she has there, and she said I tried to get rid of this, I can't get rid of it, so she must have pressed on it, correct? Or tried to squeeze it and it wasn't budging. So instead of her doing that, as I said, we have special equipment here that we will use and do it very delicately. There are these types of tools out on the market, but again, in the wrong hands, sometimes it can be even a little bit dangerous to be using. So if you try very gently to remove something and it's not working, then by all means come in and see the dermatologist.
Okay.
Okay? So we're going to try and do that, and even when you come here professionally, sometimes they can be stubborn. And if we just maybe can disrupt that, it may come out on its own with her washing her face, but we're going to try and get rid of it for her all at one time here. So what I'm going to do, I'm going to open up my little extracting tool here. And I also need a small little gauge needle here, which is very tiny. I'm going to take a little alcohol here and just cleanse that area gently. And I think when you cleanse that, you can actually see that little papule a lot more. It's like a little white dot there. And then what I'm going to do is ever so gently, I'm going to try and just open that. I don't know if the camera can get that. I'm going to kind of pick on that. That might even be enough picking to, and this tool has sort of a little bowl here at the end. As you see, it has this ominous looking sharp point, which I am not going to use. But I just hold her skin tautly and press on that. Do you see that? I don't know if the camera can catch that, but it's already popped out.
Neat.
Okay.
Wow, that didn't even look, did that hurt at all?
No, it didn't hurt
And if
at
I
all.
took the needle and pressed through there, you can see on that little
that's
needle
like a
the little
little-
white papule that was trapped inside her port. See that?
Interesting.
Okay. And
I think I
that's-
would rather trust you with the device like this. Equipment
Yeah,
at home, and could
like
you
I said-
imagine using that on your face?
Yes,
You
I
could do
mean,
more
you know, if
harm
you
than
gave
good.
this tool to somebody and said, okay, get rid of that thing, they'd be in the mirror trying to poke themselves with the
gosh.
sharp end or something, and we don't want that.
Right.
Okay, now this one's a little bit deeper, so we're going to try and do the same thing with that one, if we can remove it for her. And this is really the worst part. You know how they say, don't pick at your skin? I'm picking at Marie right now, but I'm picking...
In the right way.
Yes, exactly. So we'll try and get rid of that one for her also. And I believe we've expressed that one also.
Wow, that's so neat.
Okay. And that's basically the treatment right there. Now we will put a little bit of antibiotic ointment on there. I just want to put a little alcohol and wash that off for her. It may sting and burn a little
Now,
bit.
how do these form, or they just form on your face from?
They do. They just form. They're just kind of a clogged pore. Sometimes, you know, if you're using a lot of rich moisturizer and whatnot, that can clog the pores a little bit. But sometimes they just form. I get them myself, and most people, get them at one time or another. You can get them around your eyes here, any place. They can form anywhere. Now she has a little pinpoint bleeding, but that's going to stop in a moment.
Right. All right. Well, now we've got rid of the old yucky stuff. Now it's time to do the fun stuff and do the lip fillers with Dr. Schleicher. All right, so we just got done removing the little whiteheads, and now we're going to do the fun part, the lip injections.
Exactly, and you can see where the little millia were, those little red spots, but they're gone, thanks to our expert nurse, Mary Ann. And now what we're going to do is lip, okay? And we have thinner upper lip than lower lip, which is usually the case. And it's very, very easy to build up the upper lip. Some people require both upper and lower lips. But
my question is, when people do get this done, and like you said, some people like their lips very full, some people go overboard. When you're looking at doing this, shouldn't it look natural? Sometimes people get so much that it almost looks like they have, I don't know, cat lip or something.
Well, yeah, I totally agree with you. If you
what are you
too
looking
much in, then it looks unnatural.
Sometimes less is
but I
more
mean, if
with
you want to
this.
be on Beverly Hills Housewives, you put too much in.
Do you want to be on Beverly Hills?
That's what it boils down to.
We'll make her look just
Yeah, I
enhance
mean,
her
but I'd
features.
say you want to look natural. Around, Hazleton, Pennsylvania, Northeast Pennsylvania, you want to look more natural.
Okay.
And what we do is we just basically go right. There's a little border here. We go, and we put the filler right in the border. And we use that to and we fill that border up. And like that.
How you doing?
Good.
Okay.
Yeah, it's not. Before they had xylocaine, we would give nerve blocks, and that's painful. But
How long does something like this last?
well, the lips. Unfortunately, the lips only last about 3 months or so. There are other fillers that last longer in the lips. Again, this filler that I'm using, for anyone who's never had lips done before, we use something called Prevel Silk, okay, because it's easier to work with. For people who've had this done who want longer acting, let me just scoot over here, we use another medication called Juvederm Ultra. And
It's amazing what they come out with every year, a safe
Yeah, it's
product
great,
like this that
actually.
could accentuate what you already do have, right?
And we're just doing, now what we're doing is something, real natural, because
You could tell
it's the
immediate
first
results
time.
with this.
Yeah, you can see immediate results, but I don't want to overdo it because it is the first time. So, there, and you can see the immediate fullness, okay?
Wow.
And
They look great.
yeah, and we put a little bit here, this,
Well, now, will there be any scarring or not scarring, excuse me, bruising?
no, usually not in the lips.
And the needle is
needle is very, very
thin.
tiny. So there, and we accentuate the area right here. There, and we'll build up a little bit more here. There, and then it's just a matter of evening it out, and I can squish it, and people at home, when they have this done or who come in here, you have up to an hour or so, you can actually mold it. So if you like to mold it, sure, be my guest. But this looks real even, looks real natural.
And how many years have you been doing this? When people are looking to get this done, they should really look for qualifications. You make it look easy, Doc, because you've been doing it for a while.
Yeah, I've been one of the first people who actually used to use collagen. And I was one of the first doctors to use it, and we're talking 1980s, okay, is when it first came out. So I've been using these since then. I teach many other people how to use these.
To educate our viewers at home, if this is something you're interested in doing, what should they look for in their doctor if they are from out of town?
You want to look for someone who actually does many of these. Okay, that's really important. If you find someone who's board certified, dermatologist, plastic surgeon, yeah, that's really, really important.
And the product is important too. You want to make sure that what you're getting is what.
Right, because I unfortunately, I do see things done, by people who have less experience, and they just don't look. The only good thing is these fillers are not permanent. So if you don't like the looks of it, it's going to wear off. Okay, that's a good thing. So, but we can see. You can see.
Now, do you usually, if they need it, do you do bottom and top lip? Now, Marie doesn't need
Yeah.
both,
You can do both. And now I can make her lips twice as big very easily. Okay, but I want to see how she likes her lips just like this. And if she wants bigger lips, sure, we could use double the amount and put more in and give her even bigger lips. So, but again, this is the first time she had her lips done. So. It's similar to Botox. The first time you have Botox done, some people just use too much Botox, and you don't want to do that because you look unnatural. Why look unnatural? You want to look natural. You want to have it done so it's subtle, so you don't walk out of here and somebody goes, "Geez, what'd you do to your face?" Well, you don't want that.
And as you were, and we do mention this this is our most popular show by far. Do we get the comments on the filler shows and the shows where we're doing these mini cosmetic surgeries, not surgeries, but procedures, and the more that you get it done,
well, especially with Botox, you're absolutely right. With Botox, and there's actually a new agent called Xeomin, which is another form of Botox. But you are absolutely right, and especially, we'll come back. Like everybody else, she's starting to get little lines here. If we hadn't done that little procedure, we would have put a little Botox or Xeomin up here to get rid of these crease lines. And over time, yes, you're training the muscles, and hopefully you'll need less of the product. But it's really a godsend to many people because until Botox came out, you could see she's got lines up here. No great way of correcting them. Botox is simple, it's basically inexpensive, works virtually immediately, and you repeat it maybe 3 times, 4 times a year, the most.
How are you feeling?
So,
Good.
Okay.
Good.
right?
Is it?
It's just a little pinch. I think it's more of the not knowing that's
right.
scary.
Exactly, exactly. But she did great. She's a great patient, and you can see she's got fuller lips.
All right.
And that's using a small amount of the product. I mean, like I say, we can make her lips twice as big, and if she wants bigger lips next time, we would use more product. All
right. If you have any questions, you can get in contact with Dr. Schleicher, and if you would like to write to us, you can check me out on Facebook at Jeannine SSP TV. We enjoy all of your questions, and I'm sure Marie will be enjoying her new look for the holiday season. Thanks for joining us here on Skin Sense, and we'll see you next time.